Welcome back to the Deep Dive. We've put together something specifically for you today, our favorite listener, the learner, because the question we're tackling today, it touches on this massive blind spot in women's health.
It really does. It's one of those areas that just doesn't get talked about enough.
Yeah, exactly. And it's one of those things where biology and, well, structural engineering completely overlap.
Mm-hmm.
Like if you think about it, when you build a house, you put a tremendous amount of thought into the front entry.
Right, the front door.
Right. You install these thick, heavy, insulated double doors. And those doors, they really only have one fundamental job.
To keep the outside out.
Exactly. To seal off the house and protect the delicate interior from, the harsh, unpredictable elements outside. But imagine if over time, the insulation inside those doors just started to shrink.
Or warp, yeah.
Right, warps. And so the doors don't close right anymore. A gap forms.
The weather gets in.
The weather gets in, the interior gets constantly exposed to the elements, and suddenly the whole internal ecosystem is completely compromised.
It's a remarkably accurate way to look at human anatomy, especially what we're dissecting today.
Yeah.
Because the human body has its own set of protective double doors.
Okay.
And when their structural integrity fails, it's not just an aesthetic change. The consequences for the entire local biological environment are profound.
Right.
And honestly, often incredibly painful.
Yeah. Which brings us to our focus today. So we are exploring the mechanics of labial plumpness, specifically how restoring that structural volume physically restores the anatomical closure of the urogenital cleft.
Mm-hmm.
This is in women experiencing what's called a wide genital hiatus.
Right.
And we've told the clinical data, the foundational anatomy textbooks, and the latest functional medicine studies so we can really figure out the how and the why of this condition.
Yeah, and importantly, how modern medicine is fixing it.
Yes. So, okay, to understand how to fix the closure of that cleft, we have to look at the baseline architecture, right?
Right. We have to start with how the vulva is built to function in the first place.
How was the house built?
Exactly. And there is a very stark, deliberate contrast between the inner and outer structures.
Okay.
So if we look at the inner structures first, the labia minora, or the inner lips, these are entirely mucosal folds.
Meaning what exactly?
Meaning they do not contain fat.
Oh.
They are hairless, delicate, and they are completely packed with sebaceous glands.
Okay, and those glands do what?
They constantly secrete fluids to maintain a lubricated, moist environment. So they physically guide the flow of urine and they shield the vaginal opening.
Okay, let's unpack this for a sec because I want to make sure the physical picture is just crystal clear.
Sure.
The inner lips are highly functional, but they are essentially an internal mucous membrane.
Right, like the inside of your cheek.
Oh, wow. Okay, like the inside of your cheek. So they are wet tissue. They are absolutely not built to withstand friction.
No, not at all. So you have to contrast that wet tissue with the labia majora, the outer lips.
The double doors.
The double doors, exactly. They form the outer lateral boundaries of the pudendal cleft.
Which is sometimes called the cleft of Venus, right?
The cleft of Venus, that's the vertical fissure housing all the delicate inner structures we just mentioned.
So the clitoris, the urethra, the inner lips themselves.
All of it. And unlike that delicate inner tissue, the labia majora are covered in keratinized squamous epithelium.
Whoa. Okay, big words. Let me pause you there.
Fair enough?
You basically mean it's toughened outer skin, right? Like the skin on our arms or legs.
Yeah.
As opposed to the delicate wet tissue inside.
That is the perfect translation. It is toughened, weatherproofed skin.
Got it.
It grows pubic hair. And crucially for our discussion today, it contains a massive amount of adipose, or fatty tissue.
Adipose tissue. Okay, this is where the weather stripping and shock absorber analogy really clicks for me. The outer lips are deliberately filled with this fatty tissue, and they're bounded by smooth muscle. So they act as a literal cushion.
A physical barrier, yes.
Their entire evolutionary design is to meet in the middle, seal that cleft shut, and lock that internal mucosal environment away from the outside world.
Yeah, and if we connect this to the bigger picture, the embryological development completely proves your point about evolutionary design.
Wait, really? How so?
Well, when a fetus is developing in utero, the labia majora develop from the exact same embryological tissue as the scrotum in males.
No way, really?
Yeah, it's a structure called the labioscrotal folds.
Huh.
And the inner lips, they develop from completely different tissue, the urogenital folds.
Okay.
So just as the scrotum is a robust external structure built specifically to house and protect the testes,
Right.
the labia majora are biologically engineered to be the heavy-duty guardians of the vulvar vestibule.
They take the hit so the inner anatomy doesn't have to,
Exactly.
which perfectly sets up the central problem here.
Right.
Because the outer lips, they rely heavily on that specific volume of fat and connective tissue to maintain their protective seal.
Right, that loft.
But that tissue doesn't stay perfectly pumped forever. I mean, I'm looking at the mechanisms of deflation from our sources here, and it seems like a perfect storm of aging and just life events.
It really is a confluence of physiological factors. They all just chip away at that volume.
Because as we age, we just naturally lose subcutaneous fat and collagen.
Right, across our entire bodies, yeah.
Yeah.
And the vulva is no exception to that.
Right.
But this specific area is incredibly hormone dependent.
Okay, so menopause.
Right. When a woman goes through menopause, the severe drop in estrogen levels significantly accelerates the thinning of these tissues.
Wow.
The fat pads shrink, the collagen degrades, and the tissue just loses its elasticity.
And it's not just aging, right? Because the research highlights massive weight loss as a trigger, too.
Absolutely. If you lose, say, 50 pounds, you are losing fat from everywhere.
Right, you can't spot reduce fat.
Exactly. And that includes those protective pads.
Plus, I'd imagine the sheer physical trauma and stretching associated with childbirth can permanently alter the structural integrity of the area.
Yeah, all of those factors lead to the same mechanical failure, which is deflation.
Deflation.
The labia majora lose their firmness. The skin begins to wrinkle and sag.
Right.
Think of taking the filling out of a heavy winter coat.
Oh, that's a good visual.
The fabric shell is still there, but the structure, the loft, is completely gone.
Which leads to this massive structural consequence that the medical literature calls a wide genital hiatus.
Yes.
Translate that for us, because genital hiatus sounds like a, I don't know, pause or a break. But in anatomical terms, hiatus means a gap or an opening, right?
It means a physical gap. Without the volumetric plumpness, that fatty loft to push the left and right outer lips together,
Right.
the cleft gapes open.
So your double doors are permanently stuck ajar.
Exactly.
And what happens next is described with this almost theatrical term in the text.
Yeah.
The unveiling effect.
The unveiling effect, yeah. Because the doors are open, the clitoral hood and the labia minora are unveiled.
Unveiled to the element.
Right. They were previously safely tucked away behind full, plump outer lips,
Yeah.
but now they protrude outside that protective boundary. They are literally sitting out in the open.
Hold on. Let me make sure I'm wrapping my head around this.
Okay.
If a patient suddenly notices her inner lips are sticking out, or she feels like they're protruding in a way they, never did in her 20s,
Right.
it's not that the inner lips magically grew.
No.
It's that the outer lips retreated.
That distinction right there is the key to understanding this entire condition.
Really?
Yes. It is a relative protrusion.
Relative protrusion.
The inner structure stayed the exact same size, but the surrounding architectural support collapsed around it.
So the house sank, making the chimney look taller.
Exactly.
Wow. And the functional fallout of this unveiling, it just has to be brutal.
It is.
Because we established earlier that the inner lips are a mucosal membrane. They are wet, delicate tissue, like the inside of your cheek.
Right.
Now they are permanently exposed to an external environment they were never meant to face. I mean, I'm just thinking about the friction.
Oh, the friction is constant.
Wearing a pair of tight jeans, or God forbid, going to a spin class.
Yeah.
Sitting on a bike seat for 45 minutes with exposed mucosal tissue rubbing against synthetic fabric. That sounds agonizing.
Agonizing is the exact word patients use.
I bet.
Because the moisture barrier is entirely broken. So the first thing that happens is extreme vaginal dryness.
Because it's open to the air.
Right. The air just pulls the moisture right out, and then comes the friction.
Right.
Walking, cycling, horseback riding, or just sitting in fitted clothing causes intense, repeated microtrauma to that delicate tissue.
Oh, microtrauma.
And that leads to chronic vulvitis.
Which is what exactly?
It's a persistent, painful inflammation of the vulva.
Wow.
It also causes significant dyspareunia, which is severe pain during sexual intercourse.
Okay, so the local anatomy's ecosystem is just completely disrupted.
Entirely disrupted, and the patient is left in chronic, daily discomfort.
And with all of those symptoms, I mean, the burning, the raw friction, the dryness,
Yeah.
women naturally go to their doctors looking for a fix. They want the pain to stop. so they can just ride a bike or wear pants without wincing.
Exactly.
But this is where the medical history gets incredibly frustrating when you read these sources.
It really does.
Because the most common instinct, even among some surgeons historically, is completely backward.
It's a classic case of treating the most visible symptom while ignoring the underlying structural failure.
Right, treating the chimney instead of the sinking house.
Exactly. So a patient walks into a clinic in severe pain.
Yeah.
She complains that her inner lips are sticking out, they're rubbing against her clothes, and it hurts.
And so she asks for, or is sometimes guided toward, a labiaplasty.
Right, a labiaplasty.
Well, let's define that just so we're clear. A labiaplasty is a surgical procedure to cut away and reduce the size of those inner lips.
Yes. The flawed thought process is essentially, well, this inner tissue is protruding and catching on clothing, so let's just amputate the protruding part so it doesn't rub anymore.
Right, but here's where it gets really interesting.
Yeah.
Because cutting that tissue is a profound biological mistake, isn't it?
It's a massive mistake.
Because if we go back to our baseline anatomy, those inner lips, they are not just extra useless flaps of skin.
Not at all.
They contain incredibly dense nerve endings that are vital for sexual sensation. They house the sebaceous glands, providing the baseline lubrication for the entire area.
Yeah, the natural moisture.
And they physically act as a funnel to guide the flow of urine so it goes down instead of spraying everywhere.
Exactly.
So if you surgically amputate them just to hide them inside a deflated outer lip, you are permanently destroying highly sensitive, vital functional tissue.
You are. You are permanently altering the patient's sexual and urinary function to correct a problem that the inner lips didn't even cause.
That is wild.
Remember, the issue wasn't an excess of inner tissue, it was a deficit of outer tissue.
A deficit.
Right.
The inner lips were framed for a crime they didn't commit.
That is exactly it.
So why was cutting them ever the standard? It just seems so aggressive.
Well, historically, surgery was very focused on excision.
Just removing things.
Right, removing what seemed to be in the way, rebuilding soft tissue volume in a durable, reliable way is a much newer science.
Oh, okay.
Which is why the current functional medicine literature advocates heavily for what surgeons call the anatomically honest solution.
The anatomically honest solution. I like that phrasing.
Yeah, because instead of amputating the healthy inner tissue, the true fix is to restore the lost volume of the outer tissue.
Okay.
We call this labia majora augmentation.
Labia majora augmentation. So we rebuild the thick, heavy doors instead of chopping up the delicate furniture inside the house.
Exactly. We restore the anatomical baseline.
Okay, so how do they actually do that?
Well, clinicians achieve this by injecting volumizing agents directly into the deflated, empty space of the outer lips.
Into that empty shell.
Right. They use either autologous fat, which is fat harvested via liposuction from the patient's own abdomen or thighs and grafted into the labia.
Okay.
Or, increasingly, they use cross-linked hyaluronic acid fillers.
Wait, hold up.
Yeah.
When I hear hyaluronic acid fillers, my brain immediately goes to cosmetic injectables.
Sure, absolutely.
I think of influencers getting lip fillers or cheek fillers for anti-aging.
Yeah.
You're telling me this exact same concept is being used as a functional, structural medical treatment.
The material is in the same family, yes, but its application here is purely structural engineering.
Wow.
Because there are specific formulations, like the Zerial Plus, for example, that are engineered specifically to handle the dense, weight-bearing nature of this tissue.
So it's not just the stuff you put in a face.
Right. Cross-linked hyaluronic acid is incredibly resilient. It forms this dense 3D matrix. So when a clinician injects that filler into the deflated outer lips, they are physically plumping that tissue back to its youthful size and contour.
Let's talk about the physics of how that restores the closure.
Yeah.
Because the mechanics are actually brilliantly simple.
They really are.
You have this gaping pudendal cleft, right?
Mm-hmm.
And you inject the volumizing agent into the lateral walls, the outer lips. That volumetric expansion just takes up physical space.
It creates mass.
Mass.
Yeah.
Right. So as the left and right labia majora expand outward and inflate, they run out of room.
Exactly.
So they are brought forcefully back into contact with one another in the center.
Right. The volumetric pressure literally pushes the double doors shut.
That is so cool. And by doing that, they naturally re-envelop and hide the inner lips and the clitoral hood.
Yeah, you replace the lost structural support, and the entire local anatomy naturally realigns itself.
Wow.
No amputation required.
Right.
Inner structures are safe, the nerve endings are untouched, and all those important glands remain intact.
Okay, so that's the mechanical engineering fix on paper.
Yeah.
But how does this structural change actually translate to the patient's lived experience?
That's the most important part.
Right, because we were talking about women who couldn't sit on a bicycle without pain. What do the actual clinical outcomes look like?
The clinical trial data is definitive. If you look at the Esaline study,
The Esaline study, right?
yeah, which specifically evaluated the efficacy and safety of using hyaluronic acid for volume restoration of the labia majora.
Okay.
The procedure itself is remarkably minimally invasive. Patients receive these injections via a blunt cannula,
A blunt cannula.
which is a crucial detail for patient comfort and safety.
Break down the blunt cannula for us, because when I think of injections, most people picture a sharp needle just piercing repeatedly into a highly sensitive area, which sounds terrifying.
Right, yeah, nobody wants that. A blunt cannula is essentially a very thin, flexible, smooth-tipped tube.
Smooth-tipped. Okay.
So the doctor makes one tiny entry point with a standard needle and then slides this smooth tube under the skin.
Oh, I see.
And because the tip is rounded, it doesn't slice through blood vessels or nerves.
Thank goodness.
Right. It gently pushes them aside as it glides through the subcutaneous space, depositing the filler evenly.
Wow, okay.
It drastically reduces trauma, bruising, and the risk of vascular injury.
That makes so much sense. So what did the Esaline study track once the filler was actually in place?
They tracked several metrics over time. The visual restoration scored massive improvements on the GAS,
Which is?
the Global Aesthetic Improvement Scale.
Okay, so the GAS.
Yeah. Patients looked at the area and felt it looked restored and normal.
Right, which is great.
It is, but the metric that truly changes lives is the FSFI,
The FSFI, what is that?
the Female Sexual Function Index.
Ah, okay. And what does that measure?
It measures pain, arousal, lubrication, and overall sexual satisfaction.
Wow, all the things that were ruined by the deflation.
Exactly, and the improvements there were statistically massive.
That is incredible. And it connects this directly back to why the listener should care about this distinction between cosmetic and functional medicine.
Totally.
Because this isn't just about conforming to some, I don't know, aesthetic ideal of what a vulva should look like in a textbook.
No, not at all.
It is pure functional restoration. By restoring the anatomical closure of that urogenital cleft, the physical friction just disappears.
Gone.
The burning from the exposed mucosal tissue stops because the tissue isn't exposed anymore.
Or the doors are closed.
And when you remove chronic daily pain from a person's life, the psychosocial anxiety they carry around just plummets.
It's a huge weight lifted.
They can ride a horse, wear jeans, have intimacy without fear of agonizing microtrauma.
It gives them their life back. And that actually leads to a really fascinating biological property of the material being used.
Oh, really?
Yeah. So autologous fat is wonderful because it is a permanent integration of the patient's own cells.
Right, it's natural.
But hyaluronic acid fillers offer a very unique biological advantage in this specific anatomical region.
Okay, what is it?
HA doesn't just sit there acting as a dumb physical space filler.
Right.
Hyaluronic acid is a glycosaminoglycan.
Uh-oh. Let me guess. Another term for a molecule that does something incredibly specific with water.
Spot on.
I knew it.
It is a naturally occurring sugar molecule found throughout our connective tissues.
Okay.
And its defining characteristic is its ability to bind and retain massive amounts of water.
How massive?
Up to 1,000 times its weight in water.
1,000 times its weight.
Yes.
That is insane.
It's like a biological sponge.
Wow. So what does
Oh.
this all mean? Let's kind of trace the whole arc of this deep dive.
Sure, let's pull it together.
The labia majora, our biological double doors, they're these fatty protective cushions designed to seal off the delicate, wet internal anatomy of the vulva.
Right.
When those doors deflate, whether it's due to the estrogen drop of menopause, extreme weight loss, childbirth, whatever it is,
Yeah.
they leave the inner anatomy exposed to the harsh outside world.
That unveiling the fat.
Right, the unveiling effect.
Mm-hmm.
That exposure creates a wide genital hiatus, leading to extreme dryness and painful chronic friction.
Mm-hmm.
Historically, doctors tried to fix this by cutting away the protruding inner tissue, destroying vital nerve endings in the process.
The terrible idea.
A terrible idea.
Yeah.
But today, the anatomically honest solution is to restore the plumpness of the outer lips with volumizing fillers.
Yeah.
That volumetric expansion physically closes the gap. It pushes the door shut, protecting the anatomy without unnecessarily cutting away functional tissue.
That's exactly it. It is a complete paradigm shift from destructive excision to constructive volumization.
Right.
But it also leaves us with a profound biological implication to consider.
Ooh, okay.
Moving from pure structural engineering into active cellular biology.
I'm listening.
So we know the inner lips contain sebaceous glands struggling to maintain lubrication in a compromised environment, right?
Right. They're trying to keep things wet, but failing because they're exposed to the air.
Exactly. And we just established that hyaluronic acid fillers actively, aggressively draw water into the tissues they inhabit.
Wait. Oh, wow. I see where you're going with this.
Right. What's fascinating here is the dual action potential.
Yeah.
When a doctor injects HA filler into a deflated, dehydrated labia majora, is it possible that the filler isn't just acting as a physical, mechanical door pushing the cleft shut?
Oh, my gosh.
Is it actively changing the microclimate of the vulva?
Because it's pulling water into the area.
Exactly.
Yeah.
Could this injectable be acting as an internal biological moisturizer that fundamentally reverses the dry conditions of the genital hiatus from the inside out?
Wow.
It forces us to ask, does this treatment blur the line between a simple structural implant and active tissue regeneration?
It's an incredible thought to leave on. Because we started out talking about, replacing the heavy weather stripping on a set of double doors just to keep the wind out. But it turns out the new weather stripping might actually be hydrating the wood and restoring the entire internal climate of the house, basically reversing years of wear and tear.
It's amazing.
That is a brilliant piece of biological engineering, and it's a perfect example of why we have to constantly question old medical dogmas.
Absolutely.
Well, thank you for joining us on this deep dive, learner, and we'll catch you next time.